Flu season started early this year, but that does not mean that it's too late to protect yourself and your loved ones. Joining us now for some facts is Dr. Linda Yao, a board-certified physician with Foxhall Internists. Welcome back to the show.
Thank you for having me.
Good to have you here. So the flu season started early.
Yes.
Why would it start early? What makes that happen?
I wish we knew, but we don't.
It just happens sometimes.
Yeah, it just happens. It's hard to predict.
Now, but here's the question: when it starts early, does that mean we'll have a longer flu season?
No, not necessarily.
Okay.
It's just that it's longer because we started early and not in January.
Okay. All right. Very good. Now, this season, I know that every season there are a number of different flu viruses out there. We're all being told to go get our flu shots. Do we still have time to do that, or is it too late?
No, it's never too late, actually. No. Actually, you should go and get the flu shot if you can. There are many different types of flu shots. So if you don't like to get an injection, you can get the flu mist. You can get a little sub-Q injection this year. So
there are different ways to get it.
Yes, different ways, and I encourage everybody over at the age of 6 months.
Because they have the short needle, I guess it's called.
The short needle, sub-Q, so it doesn't hurt as much. The regular one, the flu mist, where you put it, into your nostril.
How effective is the mist?
Very effective.
Yeah.
Actually, it's very effective, and some people would say that it's a little more effective depending on the year.
Okay.
Yeah.
Now the mist, I'm told that you need to check with your doctor first because not everybody has the mist.
Yes, I guess it's more convenient for some, probably smaller doctor offices, to only just get the injection. But most, I think, pediatrician offices, just because a lot of kids don't like to have shots, have the inhaled type, and then our office gives it to anybody between the ages of 15 and 50.
Okay.
So
now, whatever you're going to get, whether it's the mist, whatever type of injection, is the vaccine that we're getting this year, can it handle the different strains of the virus that are out there? So
far, the CDC says that it seems to be very well matched.
Okay, that's good. We have some basic advice because we want to talk about preventing the flu, and as I looked over the tips, they're very similar to preventing a cold. Can you talk to us about that?
Yes, exactly. So the flu virus is very infectious. So basically, you want to avoid anybody who's sick. But
and if you are sick with the flu, don't go to work.
Right. Don't go to work. Stay in bed. Try to get lots of rest, sleep. Try to drink lots of fluids. Do your best with washing your hands. Don't cough into the air. Try to cough into your elbow if you can. So all of those things are very helpful. Okay.
We wanted to go through some facts and fiction. And I'll just run through these. You can tell me what's a fact, what's fiction. Well, you just said don't forget to wash your hands. We have that. Have a little chicken soup.
Right. That actually has been very helpful.
Yeah, it's been proven to.
Yes, it's been proven to help people and makes you feel better.
We don't really know why, right?
No, like a lot of things in medicine, we don't.
Bundle up or you'll catch a cold.
That's not necessarily true. I think, if somebody, of course, has some underlying diseases and their immune system is down, that might be helpful. But in general, that's a fiction.
Don't go outside with wet hair.
Right, that's fiction also.
That's fiction as well, okay.
Yes.
And of course, get your sleep. You said we should do that. And the drinking of a lot of fluids, that helps as well.
Absolutely.
All right, very good. So plenty of vaccine available this year. We don't have a shortage.
Plenty of vaccine, no shortage. This year's vaccine includes, the H1N1 famous vaccine from a few years ago. So it's all rolled into one.
All right, very good. Dr. Linda Yao with Foxhall Internists with information about this year's flu season. Thank you very much.
Thank you for having me.
Good to have you here.